Okay. Now that we've been talking so much about postures and body positioning, ergonomics, body consciousness as integral components to this retraining phase of the program, I want to discuss a little bit about why that's so important and what it's avoiding and what we're going to do about them. Okay, so these are known as the cross syndromes. And what you can see going on here is an imbalance of muscle systems from the front to the back planes of the body. This happens in the lower body as well as in the upper body, with muscle imbalances from the front to back and back to front and the upper body as well. Cross syndromes are a direct result of poor postures. They're not necessarily painful in and of themselves as part of the disorder, but more of a result of prolonged sitting, weak, deconditioned spines, and poor postures. The patient can start to feel low back pain and neck pain as a result when this has been going on for long periods of time and the muscles themselves have become shortened. When these muscles get short and dysfunctional and imbalanced, they can really put pressure on the spine in different areas, causing what we know as facet syndromes, where the joints are jammed together, creating localized pain, and then eventually osteoarthritic deconditioning with bone spurs and thinning disc and the like. So a lot of the patients with these syndromes are going to notice pain in the back. So let's take a look here at the lower cross first. So what we're noticing when we're talking about these is that we're going to have some tightness in the hip flexors. And this comes from constant sitting. The person's always sitting, so the hip is always at a 90-degree angle. In the car, a lot of times we sleep on our side in this position. We're sitting on the couch. Or you can have actually a tight hip flexor from running because your hip is flexing a lot in the running motion. But the majority of what we're going to be talking about today pertains to constant sitting. So we have that tight front of the hip, the tight hip flexor. We're also having the tight erector spinae muscles, which is the group of muscles that run the length of your spine in the back here, which is the main component of what we're doing here in this program. Contrary to that, we're going to notice weakness in the front of the body here. Usually weakness and maybe a little bit of extra developed adipose tissue, fat cells being laid down, and weakness in the glute system as well. So this is where most of us carry our weight. And then we have tightness in these muscles and tightness in these muscles. You can see those across from each other. This person traditionally stands sort of with the belly protruded and the hips locked out, and could have a habit of putting their hands on their back. They might think of it just as a habit, but it's usually a sign of a lower cross syndrome. The prolonged standing will intensify the pain, and flexing it, as in the example of sitting, will decrease the pain, which therefore is like a chicken and the egg problem. The person tends to get in this position more often, leading to more contracted muscles. These types of situations can definitely happen from sitting at the computer for too long, driving for a long period of time, watching TV, cyberneck, text neck, as we call it, from texting too much, being on the screens. It can even come from just reading, or even biking can give you these types of problems. Here in the upper body, we notice that we're having weakness in the deep flexors of the muscle of the neck, and weakness in the posterior shoulder elements. So the rhomboids, the serratus, the lower trapezius, and the subscapularis. And then we're going to have tightness in the muscles of the posterior cervical spine. So the splenius capitis and cervicis, the upper trap, the levator scapula, are all going to have knots and problems in the back of the neck. Person is also going to have a tight anterior chest wall, even if they're not aware of the pain that it's not a pain producer. They usually always present with tightness in these muscles. A nice way to sort of look at this is to go ahead and take a look at some of these. Okay, so here we are looking at a lumbar spine. And one of the things that we notice in this spine is too much arching along this angle. This is known as the George's line as we drive up the back of the vertebrae. And if you just look at my line, you can see kind of a rather extreme angle versus just sort of a natural angle, where if we had a natural angle, that would indicate that each one of these vertebral bodies is carrying the right amount of weight and not too much in one area. This sharp angulation, because of the weakness in the anterior muscles here of the abdomen, is creating a jamming type situation with the back of these vertebrae. And that's what we were talking about with that Facet Syndrome. So the spine is designed in such a way that we are to carry a third of the body weight through the vertebral body, a third of the body weight through the posterior element. We'll just call these the posterior elements, and a third of the body weight through the disc itself, which acts like a sponge. When we have either too much angle to the spine or too little angle to the spine, it wears down on the vertebral bodies. We want to have just the right amount of angle to the spine. Here we're looking at a cervical spine that I've already annotated. So the George's line, the angle that the vertebrae should be in, I have here in green. And the area that this person's spine is in the red. So as you can see, we're so straight up and down or even reversed in the forward position that these posterior elements aren't even doing any work to hold the weight of the spine up. In fact, these areas aren't even working at all. They're completely gapped. So when we're not using this component to carry the weight, guess where all the weight is? Yes, right there on the discs. And the discs were down, and the front of the vertebrae start to develop bone spurs. And that's the beginning of the osteoarthritic process. So obviously it's really important that we want to get that head right over the shoulder blades. Okay, so coming back to just the way it looks from a postural position here, we can see that the posterior part of the cervical spine lands in front of the shoulders, and we don't want that to be the case. So what we're going to be working on is really quite a simple concept. We need to start pairing coordinated strengthening exercises along with stretching of the weak muscles and, of course, ergonomic conditioning of the tight ones. This should not be left untreated. The effects of this condition can harm your athletic performance, reducing your freedom of your movement and making even proper breathing difficult. If it's not treated, this can lead to that eventual damage of the spine from constant pressure on the front of those vertebrae. So what we're going to do to help counteract this situation, if you think you're somebody who might have some component of this, and 80% of the population does, is we're going to have to start with a way to stretch. We're going to be stretching the muscles in the back of the neck. We're going to do that using McKenzie retractions. And we're going to be stretching the muscles of the anterior chest wall with what we call the corner stretch. And then we're going to be, let's go back to that guy. Then we're going to be strengthening the muscles of the back of the shoulder area, the subscapularis, the trap, and the rhomboids to kind of get us out of that forward slouched shoulder position. And we're going to do that through tricep dip push-ups. And we're going to be strengthening the anterior cervical ligaments, the ones that sometimes you notice are weak when you've been in a sit-up position for too long. We're going to be strengthening those with chin lifts. Okay, and then when we get to our lower body, we're going to be stretching this tight musculature on the back of the body, mostly with Mackenzie extension exercises. And we're going to be stretching these anterior hip flexors with warrior and kneeling psoas releases. And then we're going to be strengthening our lower abs and our core when we get to our core exercises, and strengthening our weak glute system. And by balancing, stretching where we're tight and strengthening where we're weak, we should see a significant diminish in the cross syndrome and actually see an improvement in our posture. So let's get to it.